Bismillahirrahmanirrahim. Factors affecting anterior drug absorption. Uh, Number A, physiological conditions which modifying the drug absorption. These physiological conditions including GIT motility. Generally, it is considered that GIT motility is inversely proportional to the drug absorption. That is, greater the GIT motility, absorption will be lesser. Let's suppose this star is drug. If this drug is moving fast due to increased motility, this drug can cross stomach and intestine fast with decreased absorption because the time of contact of the drug with the absorbing surface is less. The absorbing surface need proper time. The absorbing surface needs proper time of contact with the drug. अगर एक ड्रग एब्जॉर्बिंग सरफेस के साथ प्रॉपरली बाइंड हो और कुछ टाइम ले ले तो वो ड्रग आसानी से एब्जॉर्ब हो जाएगा, लेकिन अगर वो एब्जॉर्बिंग एरिया पे स्टे न करे तो उसकी एब्जॉर्प्शन डिक्रीज होगी. And let's suppose this drug follow this green pathway, this drug crossing this GIT slowly due to decreased motility. So this drug will take maximum time of contact with absorbing surface. So the drug is moving slowly and absorbance will be more because there is more time of contact. But sometimes the decreased motility also leading to decreased absorption. The decreased motility leading to decreased absorption. Let's the drug is slowly moving from this stomach to this area and the drug is absorbing from this area. Now the drug taking longer time in stomach and can't reach to this small intestine and the drug cannot get absorbed from this stomach. So इस drug के लिए rate of absorption will be slow. The transit of drug through GIT motility also depend upon the food recently ingested found in stomach or the stomach is fasted. Normally the fasted GIT leading more absorption. This is normal phenomena, but this is not exact mechanism. Next factor is gastric emptying time. Generally, it is believed that acidic drug get absorbed from stomach and basic drug get absorbed from intestine. Due to which difference? Because stomach is acidic and intestine is basic. But the major site of absorbance for both acidic and basic drugs, that is small intestine, due to larger surface area. So इधर स्मॉल इंटेस्टाइन में चूंकि विलाई बहुत ज़्यादा है, दिस इज द स्ट्रक्चर ऑफ विलाई एंड दिस इज विलाई and endothelial cells of villi. Again there is a microvilli. So microvilli and villi responsible for drug absorption. Greater the concentration of microvilli and villi, greater will be the chance of absorption. Greater will be absorption rate. So at small intestine, both the acidic and basic drug can absorb. But if there is delay in stomach emptying, the drug will stay in stomach and will not move toward intestine and drug absorption will be slow. बहुत से factors है which affecting the gastric emptying time, for example, nature of food. So generally carbohydrate easily move the stomach, एंड इसके लिए जो एम्प्टिंग टाइम है वो कम है. लेकिन फैट्स के लिए द फैटी मील टेक लॉन्गर टाइम. अमाउंट ऑफ द इंजेस्टेड फूड ज़्यादा का है या कम का है, इट्स आल्सो अफेक्टिंग द ड्रग एब्जॉर्प्शन. बट अगेन दिस इंजेस्टेड फूड डिपेंड्स अपॉन द नेचर ऑफ ड्रग, कि वो लिपोफिलिक है या हाइड्रोफिलिक है, एसिडिक है और बेसिक है, वो ड्रग कैन इंटरेक्ट विद द कॉन्स्टिट्यूएंट ऑफ फूड और नॉट. तो इसमें बहुत से फैक्टर्स पे इन्वॉल्व है कि अमाउंट ऑफ इंजेस्टेड फूड क्या असर करता है. प्रिंस ऑफ ड्रग इज जनरली एंटीकोलिनर्जिक एंड निकोटिनिक एंटागोनिस्ट ड्रग्स, even GIT, anti-GIT motility drugs delay gastric emptying time. Emotional conditions, age, temperature, effect of body posture. इफेक्ट ऑफ बॉडी पोस्चर. जिस तरह के हम मुसलमान सोते हैं, दिस इज़ वेरी बेस्ट वे ऑफ स्लीपिंग, because in this condition the Islamic recommended condition of lying is very fruitful in gastric emptying. Similarly, pathological condition also affecting the gastric emptying time.